Good morning and welcome to Health and Social Services. Can I have a roll call, please? And moving forward, is there any declarations of pecuniary interest from any members of council? Moving on to adoption of the minutes from April 4th, can I have a mover? Councillor Anderson, Councillor Dyes. Oops. Any questions? Hearing none, seeing none. Any opposed? We have no statutory public meetings, and we have up on deck here, we have for presentations our illustrious Dr. Robert Kyle.
So good morning, Chair, members of the committee. Great to be here this morning. Before I begin, I just want to thank Zareen Butt, who's our Manager of Health Policy and Equity in my office. She has prepared today's deck, and there was a companion information report number 31, which was posted on the second last cycle of the CIP. The other thing I wanted to mention is that actually to remind you that Council is our Board of Health, and as such, under the Health Protection and Promotion Act, Council has certain legal obligations, and our role as staff is to assist you in carrying out your obligations and otherwise to assist you in making evidence-informed decisions. So one of your obligations is to conduct a self-evaluation. So to assist you in that, we administered to members of committee a self-evaluation survey in the fall. This is my first opportunity to thank committee members who did respond to the survey. And one of the questions or suggestions that was raised is written here, perhaps brief updates at committee on the Durham Health Checkup, annual health plans, and advocacy. And so this is our first opportunity as staff to respond to that suggestion. So before digging in, just a reminder of what our collective responsibilities are when I say ours, staff, as well as council, with respect to public health. So the province grants to boards of health under the Health Protection and Promotion Act for the delivery of mandatory and related public health programs and services that meet the HPPA and the Ontario Public Health Standards. And taken together, the HPPA and OPHS really prescribes what we do and how we do it in public health. The provincial funding is set out in the Public Health Funding and Accountability Agreement, and boards of health must operate in a transparent and accountable manner in accordance with the organizational requirements, and boards of health must ensure a culture of quality and continuous improvement and demonstrate transparency and accountability to clients, the public, and other interested parties. So what have we put in place to assist you in carrying out those responsibilities? So more on accountability than reporting. We have been accredited by Accreditation Canada since 2017. We're one of 3 or 4 public health units that are so accredited, and we're the only paramedic service that is accredited by Accreditation Canada. From 2001 to 2017, we were accredited by the former Ontario Council on Community Health Accreditation. We develop an annual health plan, and the health plan consists of program priorities, and these include priorities identified by management to highlight and does not include the full scope of program activities or objectives. And the 2024 health plan is available on durham.ca/health. So the picture on the lower left-hand side is the banner for the 2024 health plan. And on the right-hand side, it is a list of the accordions that make up the 2024 health plan. In addition to the health plan, the health checkup is our annual performance report, and it includes year-end results for our priorities, highlights from key program achievements through data, infographics, and descriptive stories. Our 2023 health checkup, it will be posted on Durham.ca in the spring, and the picture is just a screenshot of the banner for our current health checkup, which is circa 2022. So in addition to those two processes and documents, we provide reports to Regional Council on the reporting side, and these include regular updates on programs and services through quarterly program reports. Program and topic-specific presentations are presented to you as needed, and we prepare an annual advocacy, engagement, and partnership report, and it highlights the groups that we collaborate with. It documents how we've met requirements regarding engagement and collaboration, and it reports on our advocacy efforts through the tables that we sit at. It is posted on the Board of Health manual, and that is the online home that we maintain, which includes the key foundational documents related to our and your public health mandate. And the picture on the lower right-hand side is the screenshot of the current advocacy, engagement, and partnership report. In addition to accountability and reporting to you and to the public, there's an additional layer of accountability and reporting to the Ministry of Health, which is our regulator. So we provide detailed program plans and budgets in an annual service plan and budget submission. We're also required to submit an annual report and attestation to provide a year-end summary and describe activities undertaken for one-time initiatives and to attest to compliance with the OPHS. We also provide the ministry with quarterly program activity reports, and they include program data and information required as part of its oversight role. And we report annually on high risks, including controls and processes in place to mitigate and manage those risks. Underpinning all of those reports and processes is program planning. We have a planning and evaluation policy that articulates our strategic and operational planning processes, including our planning cycle. Programs are established and planned to ensure compliance with the HPPA and OPHS. Program plans are documented in our program logic model template. They document activities, objectives, linkages to the OPHS, engagement with community partners, performance indicators, etc. And the PLMs document key data and information that demonstrate the community's need for program as well as information on priority populations. And where possible, of course, our program plans are aligned with the Durham Region Strategic Plan. So pulling these all together, this is a graphic which describes on a quarterly basis where we are at in terms of our documentation, deliverables, and processes. We're currently in the Q2 quadrant. All of the tasks listed in the Q1 quadrant have been completed. We have posted our health plan, as I mentioned. There was a companion report which was listed as info report number 27, and that was posted 3 CIP cycles ago. We are working on health checkup for 2023, and our goal is to finish that and report out by the end of Q2. We've already released our Q1 program reports, and they were listed as info report number 30 2 cycles ago. And we're working on the annual report and attestation to the Ministry of Health. So, Madam Chair, hopefully I have answered, at least in part, the question posed in our survey and shed some light on the processes and deliverables we have in place to ensure accountability and reporting. With that, happy to take any questions that you may have.
Thank you very much, Dr. Kyle, and thank you to the team for putting the presentation together, and for those members who did participate in the survey. And I know that a few reminders had to be sent out for participation, but it's great to see that we did get some good participation. Is there any questions? Seeing none, hearing none. Thank you, Dr. Kyle. Next, we have a delegation, and it's from Vivian Curl. Welcome, Vivian, and she's Executive Director, Durham Community Foundation, and she's joining us virtually.
Thank you, and good morning, Chair and committee members. I wanted to take a few minutes. Sorry, can you see? I'm not sure. Can you not see me, or can you see me?
We cannot see you. There we go. Now we can.
All right, perfect. So I wanted to take a few minutes to speak with you about our first vital signs report for the region of Durham. The report provides stakeholders with the information they need based on actual data to ensure our community thrives. It is a touchstone for pivotal dialogues among residents, businesses, nonprofits, educational institutions, and local government. The insights guide strategic actions targeting resources for maximum community impact. Next slide, please. In this report, we explore 8 areas of community vitality. Next slide. We invested over 18 months researching, collaborating, and synthesizing data primarily from Statistics Canada and local organizations. We found that our region is experiencing a rate of growth that has not been seen in almost 2 decades. Durham's population growth rate of 7.9% between 2016 and 2021 actually outpaced Canada and the G7. For us, the story of growth is more than numbers. It is about increasing diversity, growing populations of seniors and children, and an increasingly highly educated population. Next slide, please. Throughout the report, we talk about what is working. Next slide, please. And what is not working, like the burden we are placing on the 945 registered charities based in Durham. Most nonprofits, almost 70%, are experiencing a significant uptick in demand for their services, along with an increase in operational costs and staffing challenges. And more than half are reporting a lack of volunteers and a significant reduction in annual revenue and donations. Next slide, please. Our report also highlights what we can do as donors, funders, policymakers, and as individuals. Next slide, please. We have shared the report with our key stakeholders, and we have received significant feedback, including this quote from a local healthcare professional. What I'm struck upon reading the report is that there has never been a more urgent need for more cross-sector collaboration. The report illustrates that health is enabled by so much more than access to doctors, making good choices, and inherited good genes. I'm heartened by what I see as emerging efforts to bring social, regional, and health services to the table. It starts with building relationships and understanding what we can all do. You've identified the marginalized groups that have higher rates of experiencing homelessness and rightly recommend the need to assess and build capacity to serve populations overrepresented among the homeless. Early intervention through supportive and preventative measures targeting these groups and placing support upstream in other pipelines to homelessness are equally as important as managing the needs of those who are already homeless. But it's an approach that defies our usual way of doing things, pulling drowning folks out of the river instead of preventing them from falling in. I sincerely hope that the Vital Signs report succeeds in generating actions that improves the lives of our residents. Next slide, please. And quite frankly, that's why I'm here today. I'm hoping with your support and recommendation, we can present our full findings to Council. This report is not only helpful to the Health and Social Services Committee, but also to Planning, Economic Development Committees, and of course, Council. We know that when we connect with people, organizations, business leaders, and government, we share and we learn together. We also know that there is a great deal of relevant data and a strong narrative that offers opportunities for further engagement and action to ensure our community's future success. Thank you.
Thank you very much, Vivian, for your presentation. Is there any questions? Mayor Carter.
First of all, good morning, Madam Chair.
Good morning.
Good to be with you this morning. Vivian, you had talked about the decrease or the more demand in regards to financial pressures on charitable organizations. That's a combination of more need, more assistance, I'm going to presume. And then the second component to it is that the downloading of services are services that are required for individuals that are the most vulnerable in our country by government. Is it a combination of both?
I would say it's a combination of both. I would say that a lot of organizations that receive government funding have also seen a decrease in what they would normally receive annually. So that's part of it. And the other equally important part is that locally, we're not giving as much as we used to as donors. There's a 5% drop in donations that are going to organizations for a variety of reasons, which I'm sure we all can appreciate and understand and respect. But that is also impacting organizations for sure.
Just out of curiosity, to pick up on that point, are you finding, as you're talking with the organizations across the region of Durham, that many of the corporations that used to contribute here locally now no longer have care and control of those dollars, and now those decisions are being made out of a central zone that are distributing the funds?
Correct. That's a significant impact. And then you also look at, some organizations that had more employees working locally that are not working here anymore, and that's creating an impact as well, for sure.
I appreciate the delegation and also the report. And Madam Chair, I can point to the financial institutions that at one time were very generous in regards to supporting local organizations. Now all those decisions are centralized out of the large banking sectors, and many communities like Durham Region no longer are eligible for their support that they once received. Plays a significant role in regards to the people that are delivering these services at a time where financial institutions are making gobsmacks of money. And so I think that that's an important aspect. I think the average family and the average individual is trying their best to be able to contribute, but we also need corporate Canada to stand up, especially those companies that are profiting greatly. So thank you very much for the opportunity to ask the questions.
I couldn't agree with you more about the ask for funds for support locally. Any further questions? Vivian, I'm going to, I have a couple of questions, but also just a couple of comments. I have through the town of Whitby, we have the Mayor's Development Community Fund, and this upcoming Monday on a monthly basis, our committee reviews applications, and the rate of applications has tripled in the ask in the past year. Even for the Mayor's Gala and for the golf tournament, we had 20 applications to be for lead sponsors for $25,000, and we ended up, normally it's only one that would be a recipient, but we have increased our ability to do fundraising, which is thankful for the committee and for those around me that have helped, and we've been able to expand our amount, so we're actually doing 5 recipients for the ask. But the ask that is being asked is for food security. It's asked for the vulnerable within our community, and it's very alarming as to what some of the asks are, but we're doing our best to be able to give that support. And Vivian, you commented about, within the presentation, about with non-for-profits, that they need to be working cohesively together now and bringing the organizations together. I'm actually in the process of, with the staff at the town of Whitby, we're going to have a roundtable for those within Whitby, but I would encourage for a roundtable for the non-for-profits for other municipalities. And I know we've done something here last year at the region, but we have found substantial responses with the food banks that have roundtables we've held. We've held roundtables with the ministry, and I know Mayor Carter also has in the past, and this is the initiative that I took forward through the mentorship from Mayor Carter. But our next steps is about the non-for-profits, because we're hearing loud and clear lack of volunteers, need of more support, and need of more money to support our communities as well, because the funds are just not flowing through. To the regional chair, I would like to ask in response, can we bring Durham Community Foundation to, whether it's committee of the whole, and I know we don't have one this month, or to council, because I do believe all council needs to hear.
So, Madam Chair, the way to do that would be to put a motion forward to have this committee recommend that this presentation go to council, and I can do that now.
Okay, and we have a mover, seconder, Mayor Carter. Yep, please go ahead.
Thank you for your presentation, Vivian. And just for committee, I just want to remind committee that this year our budget included a $500,000 Thriving Communities Fund that was approved, and that is to support the non-for-profit sector, especially those, most of them, focused on reducing poverty in any of all those activities. So that is a fund that's open to all of our nonprofits, and it's for 2024.
That's great. That's wonderful. Is there any questions about the motion that's in front of us? Any opposed? Vivian, we will see you at council, and we'll get that arranged through our court clerks. And I know that through the town of Whitby, we'll be connecting with you as well. So thank you very much.
Thank you. Thank you very much.
And moving on to health, we have no correspondence or reports. And social services, we have 2 reports. The first report, 8.2, unbudgeted provincial funding for the Ministry of Education. Can I have a mover? Mayor Carter, Councillor Anderson. Any questions? Any opposed? Our second report is unbudgeted, and I'm going to repeat, unbudgeted, one-time provincial funding from the Ministry of Long-Term Care for 4 regional municipality of Durham Long Care homes. Can I have a mover? Councillor Jubb, Mayor Carter. Any questions? Any opposed? And we're moving on to other business. Is there any other business? Online? Hearing none, seeing none. Next meeting is June 6th at 9:30. Thank you very much. Motion to adjourn. Chair Henry, second by Mayor Carter. Any opposed? Thank you.